Welcome to Medically Speaking. Our guest today is Dr. Chee Kim, a cardiac specialist at the Gates Vascular Institute in the Buffalo General Medical Center. Doc, thanks for joining us today.
Mike, thanks for having me.
I want to talk about some of the exciting technology that's been utilized recently at the Vascular Institute. But before we get into that, would like to talk a little bit about your specialty as a cardiologist, in particular, atrial fibrillation. So if we can, tell the viewers at home who may be watching, what is atrial fibrillation? How often do you see that in patients?
Sure. Atrial fibrillation is the most common heart rhythm disorder that we treat. I would say there's about 5 to 6 million Americans currently who suffer from atrial fibrillation, and it becomes very common as we age. I would say over the age of 80, 10% of the population suffers from atrial fibrillation. And what it is, it's a chaotic, irregular heart rhythm that arises from the left upper chamber of the heart, and it can commonly cause symptoms of fatigue, palpitations, shortness of breath, and it is one of the major reasons why people suffer from strokes.
Do they end up going through the emergency room? Are they in their primary care office? Are they with their cardiologist? Is that a combination of that? And then how do they end up getting to you?
Sure. It really is a broad spectrum of how patients present. Some patients have little to no symptoms, and during a routine visit with their primary care physicians are found to be in atrial fibrillation. Other patients present almost immediately from the onset of their symptoms to the emergency room because they have such profound symptoms of chest discomfort, palpitations, and shortness of breath. But eventually they'll either get referred to a cardiologist who then refers it to a specialist like myself, or sometimes we get patients directly from the primary care physicians.
Got it. So when a patient does end up at the Vascular Institute, or in particular with you as their specialist, you end up doing a procedure, one of numerous that you're able to do, but cardioablation for the people who are watching in layman's term. What is cardioablation?
So an ablation procedure can treat multiple different types of irregular heart rhythms, but it is traditionally cauterization of a abnormal circuit in the heart, and that could be coming from the lower chambers of the heart or the upper chambers. So we have vast amounts of experience with radiofrequency ablation for the last 40 years or so. And then came cryoablation, where we freeze certain areas of the heart to treat these irregular heart rhythms. And then most recently, it is called pulse field ablation, which are electrical currents that we deliver inside the heart to treat these irregular heart rhythm issues. Pulse field ablation, to get very scientific, it's called electroporation, but these are electrical currents that cause electrolytes to go across the membranes in the heart tissue that eventually kills the abnormal tissue. It's a revolutionary technology, and the benefits are that it's been proven to be more effective than what we currently have with radiofrequency or cryoablation, and much safer. The energy is directed solely at the heart tissue, and it does not affect any other organs nearby the heart, which have been issues in the past with the other forms of energy.
So having new type of technology or cutting edge procedures is not something unusual for the Vascular Institute or for specialists like yourself. If you can, explain why the Vascular Institute is so important to this community when it comes to, in particular, your specialty, cardiology.
Right. So within our Vascular Institute, we have neurovascular interventionalists, we have interventional cardiologists, we have structural heart specialists, and we have electrophysiologists that treat abnormal heart rhythms. So we have a broad spectrum of specialists, and it's concentrated in one institute. In addition to that, there's a lot of basic science research that happens in the buildings, along with education of other physicians around the world and industry partners that come up with these technologies. So we have a long track record of being good partners with with industry. And so we have many times early access to the latest technologies.
But doctor, doesn't every community have a Gates Vascular Institute or something like that? Or is this something so unusual that patients from all over, say the Northeast, may be coming to Buffalo?
Right. So it is a very unique institute, and not many around in the world. We're able to broadcast live cases around the world. And in fact, I did a case recently where it was broadcast to Africa, Asia, Europe, and other states around the country. So the facilities, the infrastructure are very unique, and we have visitors from all over the world that really marvel at the technology and the advancements in the state-of-the-art facilities that we have at the Gates Vascular Institute.
Yeah, it's incredible to know that, work being done right here in Buffalo is being viewed worldwide, and people are learning and training from that. So, there's always that notion of people that have a cardiac issue, I need to go to Cleveland, I may need to go to Pittsburgh. You see this every day, you talk to patients. Why is Buffalo, why is the Gates Vascular Institute the place to go for cardiac services here in Western New York?
Right. As you mentioned earlier, we're now recognized as a leader in our specialty. So we have access to new technology before 99% of the centers in the country have it. So we just need to continue to be good at sort of educating the public on what we have available to them locally.
So Doc, last question. I know the Vascular Institute recently celebrated its 10th anniversary. What do the next 5 or 10 years look like? What's that horizon that's coming at us when it comes to, cardiology and the future of cardiology?
Right. I think having the local and regional public understand what's in their backyard and continuing to be leaders regionally in our areas, and continue to partner with industry so that we not only help develop new technology, but are able to have access to it before anyone else in the world.
Well said. That is Dr. Chee Kim, a cardiac specialist at the Gates Vascular Institute in the Buffalo General Medical Center. Doc, thanks for joining us today.
Thank you.